A common and distressing situation I see in clinical practice is when a patient gets their food sensitivity test report back and they have dozens of reactive foods. Suddenly, they feel overwhelmed, they feel like no food is safe, and they have no clue what to eat. It seems like everything they consume, they're reacting to. So today, I want to explain how this actually happens and what it really means. If you've ever looked at a food sensitivity report and felt overwhelmed because you had dozens of reactive foods, I want you to know that you're not alone. This is incredibly common. For many people, this is the point where fear sets in, and fear is not a helpful place to make decisions around food. It doesn't mean that your body is broken, and it doesn't mean that you have to avoid these foods forever. So when we see widespread food sensitivities, the issue usually is not with the food itself. The issue is typically within the lining of the gut. The intestinal lining is like a selective barrier. It should let nutrients and certain particles through and keep larger particles out. When this barrier is disrupted and larger food particles can cross through, that can activate the immune system and lead to food sensitivities. Things like infections, chronic inflammation, dysbiosis, repeated antibiotic use, and even chronic stress can all lead to intestinal permeability. When this happens, larger food particles can cross through the lining of the gut and interact with the immune system, resulting in food reactions. The immune system isn't malfunctioning, it's doing its job. The problem is, it's being exposed to things that it normally shouldn't see. Another pattern I see often is that patients have food sensitivities to the foods they eat most commonly. This is actually expected when a patient has intestinal permeability because the foods they eat most often are crossing the lining of the gut and interacting with the immune system. So of course, it's going to develop more food sensitivities or reactions towards the foods it sees more commonly. This is one really important reason why food variety and food rotation are so important. So how do you approach healing when you have many reactive foods? This is where it becomes individualized, and working with a certified practitioner can be extremely valuable. Some patients may prefer to avoid all of their food sensitivities for a 6 to 8 week period and then reintroduce carefully one by one, watching for reactions. In other patients, that might not be practical. So in those situations, I typically advise patients to pick 4 or 5 of their most common foods that are reactive and avoid those for 6 to 8 weeks and allow the inflammation to calm down in the gut. And this alone often produces an improvement in GI symptoms. Then, depending on how the patient did with that 6 to 8 week elimination, we can either experiment with eliminating other foods or start carefully reintroducing foods one by one and watching for reactions. It's important to note that just removing the food sensitivities may not be enough to heal the lining of the gut. And in fact, usually it's not the case. This is where a systems-based biology approach really comes into play. And we have to look at all things that are contributing to intestinal permeability. One common thing I see is intestinal dysbiosis, meaning the microbiome is out of balance. Patients may need a short course of probiotics or the addition of prebiotics to help the microbiome flourish. They also might need digestive support, and they might need to adjust their diet and include more phytonutrient-rich foods. Phytonutrients are those colorful, fresh fruits and vegetables with all the pigments like deep red or orange, green, purple. These phytonutrient-rich foods can calm inflammation within the lining of the gut and help it heal. It's also important to address chronic stress, and equally important to address sleep. Those foundational pillars of health have to be addressed if we want holistic healing and sustained results. As the gut heals and intestinal permeability decreases, I often see that patients can reintroduce their favorite foods. Our goal here is not restriction. We want your body to tolerate a wide variety of foods once again. And to do this, oftentimes the gut just needs a little extra support and a temporary elimination of reactive foods so that your body can heal and you can optimize your health. In the next video, we're going to talk about a group of foods that causes a lot of confusion: wheat and gluten. There are multiple ways these foods can cause reactions, and they're often misunderstood. If you've enjoyed this video, please hit like and subscribe. It really helps this new channel grow. And I'm Dr. Kate. Thanks for watching.